Now I would like to hand things off to Marlise Perez to get us started.
Thank you so much, Vivian. And welcome everyone to our listening session on the Behavioral Health Outcomes and Accountability Transparency Report. We can move to the next slide. So as hopefully some of you have been along our journey as we've been moving through our public listening sessions for our Behavioral Health Services Act, just a reminder is this is all draft information. We are hosting this today to get your feedback. And so please feel free to, as Vivian mentioned, use the Q&A. And put in your feedback. We're going to have a few questions for you along the way, and we'll stop and pause and ask those. And then at the end of the presentation, I'll provide some information on kind of next steps and where you can put additional feedback. Next slide. All right, so here is you're going to have until July 15th if after you see this presentation and you think of other things you want to provide us feedback about, you can submit it to our BHT info inbox. And as I mentioned, we'll talk a little bit more at the end about some other public comment opportunities that you'll have. Next slide. All right, so before we pop into the boater, I just wanted to take a minute to thank you. This is our 9th and final listening session for BHSA. And so been really, really excited. We've had over 3,000 participants along this journey through our public listening sessions. And of course, all of you that are able to join us today or are watching this recording. And really want to thank you for all of your feedback. It's really helped us shape our BHSA policy. And so it's really helped us. Hopefully, most of you have seen our policy manual, as that is where we've been rolling out the final and also draft policy. And most excitingly, I think, was our initial launch last week on July 1st, that BHSA is officially in effect as of last week. And this boater really wrapping up, as you'll see today, how it's really kind of the bookend for our BHSA policy. But sincerely, thank you for all the time and the feedback you provided us. And we're really looking forward to receiving your feedback on the boater. Next slide. All right, so we can move forward. So just a little level setting about the boater. So I keep saying the boater because I don't want to say the full acronym every single time. But the boater is in the statute governing BHSA. And really the intent of the boater is to have more transparency into how counties are expending the behavioral health funds across all of the various behavioral health funding sources that they receive at the county level. And we'll talk a little bit more about that in just a moment. And so the requirements are established in statute, and the boater includes information, and we'll talk a little bit more about all the different information that it contains, but generally on spending and service utilization across the behavioral health care continuum for mental health and substance use, and also the BHSA, the three components that govern BHSA. DHCS is going to use the boater to monitor the county implementation of their integrated plans, their annual updates, or the intermittent updates, whichever is the most current for that reporting period. Next slide. So the boater contains all of the same funding sources that the integrated plan contains, but just really wanted to remind you of that today. So these are the various funding sources that our county partners receive, broken down here, of course, through the various funding sources around the 91 and the 2011 realignment. Of course, all of our Medi-Cal programming, whether that is the especially mental health, or if the counties have opted into the drug Medi-Cal organized delivery system, or if they're providing state plan services. Also, all of the federal block grants that are received, the biggies of the MABG, SubG, and then the PATH grant. And then, of course, those BHSA funds, as I mentioned, broken down by those three components, and then other federal, state, or local funding, and you'll see some of those listed here. So what you're seeing in the integrated plan will be then mirrored in the BODER, except the BODER will be actual expenditures. Next slide. I want to talk a little bit about the BODER reporting timeline. So the first BODER is going to cover the fiscal year that we just kicked off last week, fiscal year 26-27. For the initial BODER, there's a one-time draft BODER that's going to be due in January of 2028. This will be the only time that there's a draft BODER. And then the final BODER for that 26-27 fiscal year will be due in January of 2029. So you'll see here on this chart below, just really wanted to provide you with this visual to show the planning that occurs in the integrated plan, and then when the annual updates are due, and then you'll see here at the bottom the BODERs. So for that first year here, our first BODER number 1, you'll see that reporting year is 26-27. And as I mentioned, that draft is due at the beginning of January of 28, and then that final in the beginning of 29. And then you'll see for that second BODER, there is no draft requirement. There's just the final that would be due in January of 30. Next slide. So there are several required components for the BODER. And so I just want to walk through these. I already kind of mentioned the first one, and that is the allocation of those various funding sources that I talked about on the prior slide. Also, any administrative costs. And then there's, as I mentioned, a lot around service utilization data. And so those are services being provided and covered by Medicare, Medi-Cal, commercial insurance, uninsured. Also, there will be information around the county performance measures, and then also populations with identified disparities, information on county workforce strategies, provider vacancy rates, and then all of the actual expenditures that I mentioned once again for those funding sources on the prior slide. And that will be including spending on children and youth, and then spending across the funding sources, as I mentioned before, and across those care continuums. So a lot of this should look very familiar to you. A lot of this is a mirror of the integrated plan with some additions that are required particular to the BODER. Next slide. All right, so you're already at our first feedback slide here. And so if you could pop on your Q&A button, and if you can't see it at the bottom there, it might be with your 3 little dots, depending on what your screen, how large it is. But if you could put in here some feedback. The first question is, are there additional components that DHCS should consider for the BODER? And so if my team could just pop us back a slide so you all can see the components. So looking at these components, are there any additional components or any feedback you want to provide us on these components? So if you could take a moment and put in your response in the Q&A, and then as your responses come in, we're just going to read out a few of them just so you can hear generally what we are hearing. If I don't read out your particular feedback, that doesn't mean we haven't received it. Donna, my team member, is going to help me with this as well. So if you could please put some feedback in the Q&A now, that would be great. So as the information and the feedback is coming in, a few little additional housekeeping, and we'll talk about this at the end as well. All these slides will be available and posted on our website along with the recording, and then also we'll have a themes report as we've done with all of the other listening sessions as well. So getting some questions about that, so just want to make sure everybody knows that. I'm getting some feedback in also about just a little bit more understanding around how the boaters will take in which years of data. And so just to clarify, the boaters will just have one fiscal year of data. And so, as I mentioned, that first boater will have data from the 26-27 fiscal year. And so, boater number two would have the fiscal year data from 27-28. So, it's just 1 year of data that will be provided in each boater. I'm getting some feedback in so far. Some folks are saying no additional components. Collaborative partnerships with community-based organizations. Some feedback on spending on older adults.
Also seeing some feedback on percentage of funds that are paid to contractor organizations versus county providers.
So getting some feedback just around like that this is more broadly across all the behavioral health funding sources and not just specific to BHSA. And I do want to clarify that it's both. So it's going to have expenditures across those funding sources that I had mentioned, but it will also have expenditures related just to the three BHSA components. And we'll be talking in depth a little bit more about that in just a moment. Some comments about the identified disparities, importance of collecting that information, but also just more guidance around what those disparities and what that reporting will look like. We do have a little bit more of that coming in this presentation, and of course would love your feedback as we get to that section as well. So just getting some general questions that we don't have answers for you today, but even in your questions, it kind of helps us frame, what it is you may want us to include. And just as an example around like administrative costs, whether or not that'll be broken out just for BHSA or across the whole system. Some comments around EHR adoption, percentage of funds to youth versus adults.
Some feedback on evaluation and planning expenditures specifically.
And also just kind of seeing once again some clarification needed around that the integrated plan that the counties are putting forward is their planned expenditures, and then this boater really is a mirror of that. So a county planned to expend funds in this way, and then the boater really is that mirror to that with some additional details. So just to clarify that. Also, some feedback around early intervention outcomes, especially around non-billable efforts. And then also just we're receiving quite a bit of feedback of not adding additional components. Great. Well, super appreciate that. If you have other feedback that you want to put into this first question, you're welcome to continue putting that into the Q&A. We are collecting all of it As I mentioned, we're going to have this open, and I'll once again reiterate at the end of the call where you can provide that information. And then I did see if my team could drop in for everybody the website, as our website where this will be posted. That would be great because I saw we had some inquiries for that as well. Just make sure everybody knows how to get there. With that, we're going to move on to the next section. So if you could move us ahead a few slides, that would be great. Awesome. Thank you so much. So next, we're going to talk about how the boater is going to be completed and submitted. So we can move forward to the next slide. Thank you. So here you will see the statutory reference to where the requirements are in statute. And as I mentioned, the level of detail that we're going to have, as we kind of talked about, is if you want to look at the integrated plan budget template, we really looked at that as we were building out the boater template, the draft that we have in play right now. And once again, there are areas, though, due to statutory requirements that has additional detail. This boater will replace what counties provide to the state now. We have a report that's called the Annual Revenue and Expenditure Report. So this boater, starting with the fiscal year 26-27, will replace that RER. We're also going to be focusing on quantitative information. Once again, that's just really looking at like actual expenditures compared to that planned expenditures that have been submitted through the integrated plan. We're really going to try as much as we can to leverage any statewide data, that we receive from DHCS to populate the quantitative elements of the boater template. So wherever we're able to make that happen, so our county partners don't have to be re-entering data that DHCS already has. We're really also really looking to ensure through this boater that we are having consistency in reporting across counties. And that also is going to provide our public, a lot of you here, information that we have with our statewide boater that we will be releasing every year for that fiscal year boater that we receive the information. That'll be released on our behavioral health public county profile. And I'll be talking about that in just a moment. One thing I do just want to highlight for everyone is because of that first boater year, that year one, we are going to have a draft boater. That's going to look a little different in the sense that while it will be the full boater, parts of it will be grayed out because our county partners won't have the information yet for all of it to be submitted. And so it'll look a little different than the final that they'll be submitting for that fiscal year. But as that rolls out, you'll be able to see those differences. So, next slide. So where possible, as I mentioned, we are going to utilize a variety of data sources that we already have at DHCS to populate various aspects of the boater. So some of that will come through that integrated plan, as I mentioned. So as an example, for 26-27, counties have already provided their integrated plans to the department. So for that first boater year, we'll be looking back at that integrated plan. But for future years, in between, each county will be submitting annual updates. So for the 27-28 boater, we'll be looking at that annual update. Or in both of those examples that I just gave, we could be looking at an intermittent update. So we're going to be looking at, for that fiscal year, the most recently approved plan information. And that's some of the information then that we would populate the boater with. We'd also be looking at our Medi-Cal claims that we could utilize, also our individual service level encounter data, which I'm going to talk about in just a moment. Some of that will be used to populate the boater, and then the phase 2 measures. And so once again, where we can populate this, there's still going to be sections, obviously, that our county partners are going to have to complete. But once again, where we have the information, we'll be populating it for them. Next slide. So what is individual service level data? So some of you may not be aware, we actually started just last week as well, a new system at DHCS, a new reporting system, and this is for individual behavioral health services. It's encounter data for services that are provided at the county level that aren't funded by Medi-Cal. We have a encounter system for our Medi-Cal data. It's called Short Doyle. So ISL is an encounter system for all of our non-Medi-Cal behavioral health data. And this data is really going to give us more insight across the behavioral health delivery systems. It's also helping with the calculation of our phase 2 measures that are going to be released this summer that we're really excited about. It's also going to help our partners in population health management as they're planning at the local level, and then also support fiscal oversight and really increase understanding of how counties are using resources to meet the community needs. So as I mentioned on my prior slide, where we have this ISL data being reported to the state, part of that data will be utilized in the BODR as something that we can populate. All right, next slide. So with the BODR submission, of course, there will be a template, and I'm going to talk a little bit more about that in a moment, but you'll be able to provide some public comment on a draft template that we'll be releasing. But obviously, when we have that template, we're going to have a response needed for each item that we're requesting. Counties also have to have approval from their county board of supervisors when submitting the BODR. And then also from the county behavioral health director and county administration officer. And then also one part, as the county board of supervisors are reviewing the BODR and approving it, they also must attest within the BODR that the county is meeting the realignment obligations. And this is a requirement that comes right from statute here. You'll see we have the citation, but that includes the time and distance and appointment time standards without using wait lists. So these are some of the submission requirements. I do just want to note we have with our two city-operated authorities, though they are also going to be submitting BODRs to the department independent from their counties, just as they have done with the integrated plans. Next slide. So our county partners are going to submit these through our county portal, just as they've done with the integrated plans. And they will be able to work in the BODR, work in the portal to develop the BODR as they're putting it together. There's a lot of technical features available to them where they can track completion across sections, assign out, have different partners at the county level, complete different portions. And there's all types of support that they're able to use within that portal, just as they have with the integrated plan. This utilizing the portal helps us integrate that statewide data that I mentioned that we're able to then bring into the BODR from the back end. And then once again, really helping us with our goal to have consistency and reporting across the counties. There's also a lot of technical support to help our counties as they're, submitting the data to us through the portal. Of course, we'll have policy support as well, but all of that can be submitted through the portal, and then there's a lot of training resources and user guides that would be available just as we've done with the integrated plan. Next slide. And so once we receive the BODR, we are going to, of course, be completing our review, looking for completeness and alignment with all of the statutory and other requirements. And then after that, we will approve the plan. However, if there's any late or incomplete information, if we need to, we'll work within the corrective action plan process. But I do just want to say our county partners were really amazing through the integrated plan process. So this is just something that we have as a tool, but hopefully we won't need to utilize. Next slide. Also, another part of statute, DHCS may impose withholds or monetary sanctions if there's a significant variance between the projected spending in the integrated plan versus the actual spending in the BODR. And so DHCS will be defining these standards for significant variance after the completion of this first integrated plan period. We're going to use this first integrated plan period, this 3-year period, to collect data and establish the significant variance standards. So those will be applied during that second 3-year process. Next slide. All right. So another feedback question here. We would like to know what other technical assistance or resources would you find helpful in understanding the BODR? So we recognize there's lots of different audiences on today, whether you are a county partner or maybe you're a provider providing services, or maybe you're a member of the public or an association. But what would you find helpful as we are developing this and rolling this out to increase your understanding of the BODR? So feel free to open up the Q&A, and Donna and I are going to read off some of your feedback. As we're waiting for some feedback to come in, just providing a little bit of clarity around ISL. No, Medi-Cal encounters are not included in ISL because those are included in our short Doyle system. We already collect those. Getting some questions too and a little feedback around significant variance. We have not established the policy around significant variance. Just wanted to highlight that today since it is part of the BODR requirements. But we have already put out some policy in our policy manual, as I just mentioned, that will be established for the second BODR period, that 3-year period. So this first 3-year period, we will not be applying the significant variance. We will be working out that policy in the next few years after we collect that first full 3 years of information. Also getting some questions of folks wanting a copy of the BODR. We have not released anything for the BODR template, but I'm going to talk about that a little bit at the end of the next step. So I'll definitely get and circle back to that. Also getting a lot of feedback around ensuring that there's consistency across the counties on how this data will be collected from providers that feed into the BODR. Getting some feedback around the TA that ongoing forums like these, open to all, would be helpful.
Also to add to that, Marlies, a recommendation for some explanatory, like videos or something like that, to provide some context and background.
I'm getting a lot of questions and feedback of like different data elements to include. So we'll definitely look at those in further detail. But I just want to be clear around the voter template. That's where it's going to have, we're going to release a draft voter template where you'll be able to see what we're aiming to collect, and that's where we're going to ask for your feedback. That we wanted to have this listening session first, and then I'll talk about when that draft will be released for you to be able to comment on.
I see some requests for different guides or sources explaining the specific metrics and how they should be calculated for consistency.
I have some comments here around the opioid settlement funding that's reported at the local level. So understanding that category of funding. Just a lot of guidance receiving from some of our county partners, more around like actual specifics. When will the portal be open with the voter, details like that, and when will they be able to start inputting data? And we will, excuse me, once we have the finalized template, we will be working on developing that system, and then we'll be providing our county partners with information on when they can start going in and providing that information.
Be a point of clarity too. There was a question about whether the county will only have to submit one voter for the entire county or whether contract providers need to submit voters. And it is one voter for the county, except for those two cities, City of Berkeley and Tri-Cities, who also submit their own voters. But that is the intention, that the providers or contract providers would feed up their data through the county.
I think we're going to keep moving because some of the feedback I'm seeing, we have some slides that are going to answer some actual questions that we're receiving. But once again, if you can think of other TA that you'd like to have us consider, please feel free to drop that in the chat. So moving on to the voter design, and we can move to the next slide. So once again, this template is going to include those county projections from the integrated plan. So there can be a side-by-side comparison of the projections with the actuals. There's also going to be a very limited narrative sections for counties to be able to explain any differences between the projections and the actuals. And then also for some of the questions, there'll be separate columns for DHCS populated data and supplemental data that's provided by the counties. Next slide. And then also the BHSA statute includes core requirements for information, one of which is around category. And so as we've done with the integrated plan, these categories will be mirrored from the detail in the integrated plan. So this is really that service level data across the mental health and also the SUD care continuums. And so like some examples of that are like outpatient services or residential services. But the other categories will include for BHSA, and those will be around those components like full service partnership, along with detail such as assertive community treatment or high fidelity wraparound. Next slide. And then I know we had some questions earlier around the disparities and what approach the department is taking around those in the voter. So these are required to be reported in the voter, and these are around disparities on all the performance and outcomes. And so those are around the measures as well as a disparities analysis. There's also, as most of you know, we've been working on equity measures that are soon to be released from the department. We've been working on key disparities through those equity measures and working with our Quality and Equity Advisory Committee as well. And then, of course, counties will be able to provide additional context on the disparities through the narrative. And I know we've received some questions around the disparity categories. You'll see here on the right, my right at least, some of the categories that we've been utilizing. And once again, once we release this information around the equity measures, there'll be a lot more, I think, detailed information that you folks will be able to understand more of the context of what will be reported then in the voter. Next slide. As I already mentioned, the voter is going to replace the annual revenue and expenditure report. And so right now under MHSA, and we'll be continuing receiving this RER that's going to be submitted 6 months after the reporting year. So we'll have another RER still coming in. Under the BHSA, though, the RER was removed from statute, and we'll be collecting that information through the voter. And that will be utilized to calculate reversions, just like we've been utilizing the ARER for that. And then also, as we've talked about, the voter will also collect some information that's not in the integrated plan, and that is needed to calculate reversions. And that is one example of that is we'll be collecting component interest. Next slide. So just wanted to give you a list here of what could be in the voter. This is what we're looking at, and you'll see this when we release the draft voter template. And so here we've already kind of walked through these, but I just wanted to provide them for you in the key areas around the care continuum. As we mentioned, expenditures by the funding sources, the summary of expenditures around the care continuum, expenditures and utilization by age, service utilization by insurance type. As we've mentioned, the BHSA components and expenditure information around that and utilization across all three of those components, along with other information that we need, as I mentioned, to calculate reversion. There's also other categories of administrative, and other county spending, performance and outcome measures, workforce development, and then those attestations that I spoke about. Next slide. So we're at our Q&A again. Can DHCS clarify any categories in the voter design? And if so, which ones and how? So I'm going to have us pop back to these categories that I just mentioned to receive some feedback from you, any clarifications that you feel like we could provide, and just open that up for your feedback. So just receiving some feedback from our counties, a little bit around the RER. So we do have one ARER that you're going to be submitting to wrap up the MHSA expenditures. That will be your last one to complete out that fiscal year 25-26 of MHSA. Just wanted a repeat of the question. Can DHCS clarify any categories in the voter design? If so, which ones and how? So that's the information I have here on the slide that's up. I'm getting some feedback around the service utilization by insurance type, making sure that we clarify what that means. And then like, would it be dependent on having received payment from an insurance company making sure it's real clear guidance there? I'm asking for just clarity to make sure that we can provide this guidance as soon as possible as counties are starting the fiscal year. So counties can configure their EHRs, making sure there's information on each of the data elements, the fields required.
Clarification on age group reporting.
Clarification on the performance and outcome measures, if those are the phase 2 measures. And just to clarify, this is what we're looking at what could be in the draft voter. Of course, we're taking your feedback today before we release the draft, so some of this could change, but this is preliminarily what we're looking at for the categories.
Clarifying for the service utilization by insurance type, if that is insurance paid or insurance billed.
Then also just making sure under BHSA with the BHSS category, since it is broader than the other two categories, like really asking, is there going to be a breakdown on that category and what that would look like? Great. Well, feel free to continue putting your feedback in the Q&A. I'm going to move us on to our last section. All right. So the voter and the county profile. So next slide. So as I mentioned, the voter is going to be publicly available on the behavioral health public county profile. And hopefully most of you have been to our behavioral health public county profile. We just released that first release. We're really excited about that. That just came out. If you haven't been there, here is the link. It's also on our website. But this is where we are providing and utilizing all the information that we are receiving around not only BHSA, but we have a lot of information more broadly around behavioral health pertaining to the services provided by our county partners, but you'll also see data and information around with our managed care partners as well. And so as it pertains to the voter, of course, it is a ways off that we're going to have any data to share on the voter, but you could even see here in our little graphic, and when you go on to the county profile, you'll see here annual expenditures and when it's going to be available. That will be available starting in 2029. It will just have the final voter data available for the fiscal year 26-27. Right now, there's a lot of other information that is on the profile around spending plans, demographic information. We have a homelessness and housing tab. We also have an integrated plan tab. And there's going to be actually another release coming out of the profile this summer that will have more information pertaining to the integrated plans and the phase 2 measures and some other reports as well. But just wanted you to know when we have the voter information, this is where it's going to be available for public access. Next slide. All right. So next slide, want to talk a little bit about the public comment process. And so we are releasing our final module for BHSA, Module 6, for those of you that have been tirelessly reading all of our policy guidance. This will be our last module for BHSA. And this, I know we've got a lot of questions in the chat. When can I see the template? So we are going to be releasing this. We are going to have narrative guidance as we have in the past around the boater, some general provisions around that. That'll be in our policy manual. We will also have the draft boater template that we've been talking about today. We're going to take some of your feedback, incorporate that as well. And then we're also going to have a user guide that's going to help you understand the different components and categories of the boater framework. That user guide is not actually for you all to have to provide any public comment on. It's for you to help understand the boater template and to kind of guide you through that. So that's going to be there available to you. I know there's been a lot of comments in the chat of how are we going to understand, that this data element or that. That user guide is going to help provide you with that understanding. And of course, after we release this for draft, we'll make changes, and then we will release a final version. And of course, we'll have the user guide updated for folks as well to be able to utilize. Next slide. And so we're aiming to release this draft of Modular 6 in the summer here. So it's coming up on us very quickly. That will be released just as we have in the past on our Behavioral Health Transformation webpage. And you'll be able to provide input as you have in the past through the online platform. And then, of course, as we've done with all our other modules, we'll take all of that feedback into consideration, and that'll be incorporated into the final version of those Mod 6 materials. There is an instructional training video if you haven't provided comments in the past that'll help you with the comment submission process. And then once we release this, we will have a due date back for you. I don't have the date today because we have not solidified that date yet, but you'll be notified of when the comments need to be returned to us. And then if you have any kind of questions around this process, you're always welcome to submit a question to our BHT info at DHCS mailbox, and we will provide you with that information. But please be on the lookout for it. And that will be coming out in the next few months. So you'll be able to actually see what we've been thinking about. Once again, some of your feedback will also be incorporated there. But please take the time, if you have it available, to provide us with your feedback. Next slide. So here we are with our final question for the listening session today. Just wanted to generally open it up if there's any other feedback that you want to provide pertaining to the boater. So just feel free to put your feedback in the Q&A. That would be great. If one of my team could put the county profile link in the chat, that would be great, or the Q&A for everybody to be able to see it, that would be great. Do want to just clarify, because getting some questions here, if the data from the final boater will be publicly available in the county profile tool in 2029, that is correct. It will be available there. You'll be able to see with our summer release of the county profile the information that we're providing around the integrated plan. That's going to give you a feel for what we're going to provide with the boater. But just as we have done with the integrated plan, if you want to know a specific county, you'll actually be able to download that full integrated plan. If you want to view that, you'll be able to do the same thing for the boater. So we'll have some high level information, but you'll be able to download the entire boater if that's something that interests you. I love the comments. I really like this person. I believe we are in summer of 2026. I agree with you, but it hasn't gotten that hot yet. So we still have another month or two of heat. So I don't have an exact date for you. I can just say to keep your eyes peeled I would start peeling them probably around August. Doesn't mean we won't be ahead of that, but that's about as best I can give you at this point. But please keep your eyes open for that. Definitely hear folks needing to really see that draft before they can provide more detailed feedback. Super appreciate that. And really looking forward to that specific feedback as well. I'm just receiving some information for us to look into as well for the non-Medi-Cal covered services, looking at the payer claims database, maybe another data source that we can utilize. So we'll definitely look into that. Great. Well, feel free, like I said, if you want to add any other feedback in the Q&A, we are collecting all of that. I do just have a few last slides here for you, so we can move to the next slide. So here are some resources. Hopefully you all have seen these, but if not, really hope that you are able to check them out on our website. We have a website page with several subsequent changes, other subsequent web pages that are linked here for BHT for our effort. We have a lot of different infographics and FAQs really helping folks understand at the broader 30,000 foot level, but also some detailed information as well. We also have some videos and recordings. We, of course, have all of these public listening sessions online if there's one you want to go back to and listen to in other webinars. And then, of course, at any time, if you have any questions or feedback, you can use our BHT info mailbox to submit questions to us there. And with that, I think we can move to our next slide. That's our thank you slide. So really want to thank you again on behalf of the department for spending some time with us today, just talking about the boater. I did see a few comments in the chat that some folks felt this was helpful, which always makes me really happy because we really, around the work we do here at DHCS, and especially around BHSA and BHT, we really want and welcome your feedback. You all have been integral in this process as we're rolling this out, as we are really looking at, putting our best foot forward as we continue to do in California around behavioral health services across the care continuum. So really thankful for your time today and for joining us on our last listening session for BHSA. And with that, I'm going to say adieu and have a great rest of your day. Thank you all, and look for that module 6. Take care. Bye-bye.